So after median nerve, we're going to discuss one more nerve, ulnar nerve. So ulnar nerve, you have to know some basic points. Ulnar nerve, it is the branch of medial cord of the brachial plexus. It is the branch from the medial cord of the brachial plexus. Now medial cord is formed by anterior division of the lower trunk. Lower trunk is formed by C8 and T1 fibers. So what is the root value? C8 and T1. I told you in the brachial plexus topic itself, C8 and T1 fibers mainly to supply palm muscles. But ulnar nerve also supplies some muscles in the forearm. Flexor carpi ulnaris, FDP medial half. So for that, the medial cord give C7 fibers to the ulnar nerve. So the root value of ulnar nerve is C7, C8 and T1. Clear? C7 fibers given by medial cord. C7 fibers from medial cord. Okay? Joins with the ulnar nerve. So root value of ulnar nerve C7, C8, T1. Right. Now what is the function of this nerve? Again, ulnar nerve, mixed nerve, carries sensitive fibers and motor fibers. Right. Now see the course. Again, as usual, in the arm, after the formation, from the axilla, the ulnar nerve comes to arm. Now in the arm, it is present on the medial side. That's all. It is present in the medial side of the arm. Again, no branches. And it is piercing on septum. What septum? Medial intermuscular septum. So ulnar nerve pierces medial intermuscular septum. Medial intermuscular septum. Okay? Right. And then it goes behind the medial epicondyle of the humerus. See the diagram? Now this is the humerus bone. Lower end. This is medial epicondyle. This is medial side, lateral side, and this projection is called epicondyle. Epicondyle is nothing but the most prominent area. Okay, epicondyle. So now ulnar nerve is passing behind the medial epicondyle in a group. So please write ulnar nerve is present posterior to medial epicondyle. Okay. So this is the third nerve we are seeing in direct relationship with the humerus bone. So in the surgical neck of the humerus bone, axillary nerve. In the shaft radial groove, radial nerve. Behind the middle epicondyle, ulnar nerve. So these three nerves, they are in direct contact with the humerus bone. Clear? Now see the diagram. Yes. See in the recent exams, we are getting questions repeatedly from this diagram. So fracture of the surgical neck, axillary nerve damage. Fracture of the shaft, radial nerve damage. Fracture of middle epicondyle, ulnar nerve damage. Clear? So recently, they are giving some clinical scenarios. The patient is having hypothenar eminence atrophy, loss of sensation in the medial 1.5 digits. Likewise, they are framing the question and they will mark some different points in the humerus bone. This is A, B, C, D. Like this, they will mark injury at which are the following site lead to the given clinical condition. Likewise, they will frame the question. So these are the nerves in direct contact with the humerus bone. Right. So ulnar nerve from the medial epicondyle enter the forearm under the cover of flexor carpi ulnaris. So this is our flexor carpi ulnaris. Now in the forearm, ulnar nerve supplies only 1.5 muscle. What are those? This one flexor carpi ulnaris, and what is this? That is our flexor digitorum profundus. So flexor digitorum profundus, lateral half and medial half. So ulnar nerve supplies the medial half of FDP. We'll write here. So ulnar nerve in the forearm supplies only 1.5 muscle. Flexor carpi ulnaris and FDP medial half. So medial half of FDP means tendon to little finger and the ring finger. Okay. Yes. Then ulnar nerve entering the palm. Now see the diagram. Now in the diagram, now this band is our flexor retinaculum. Ulnar nerve entering the palm by passing above the flexor retinaculum. So you write the theory. Now see the diagram. So I'm going to zoom this area so get a clear picture about the exact course of ulnar nerve and the retinaculum. Right. Now ulnar nerve is passing above the retinaculum. Yes. This is our retinaculum band. flexor retinaculum. And can you see one more ligament here? Yes, that ligament is called volar carpal ligament. Volar carpal ligament or flexor carpal ligament. Right, now this is our flexor retinaculum band. Flexor retinaculum band, and above that, yes, you are seeing volar carpal ligament, this ligament. Now between the flexor retinaculum and the volar carpal ligament, now one canal is formed. That canal is called Guyon's canal. Now who is passing inside the canal? Our ulnar nerve and ulnar artery. So ulnar nerve and ulnar artery, they are passing through Guyon's canal and then enters a palm. Clear? So we write the theory here. So ulnar nerve pass above the flexor retinaculum in the Guyon's canal and enter the palm. Okay? Right? Now you're going to see the course of ulnar nerve in the palm. Now after entering the palm, ulnar nerve divides into two terminal branches. One is superficial branch and another one deep branch. Ulnar nerve divide into two terminal branches, superficial branch and deep branch. Right. See the diagram? This is our flexor retinaculum. So ulnar nerve and ulnar artery passing above the retinaculum. Yes. After reaching the palm, they are dividing into two terminal branches. This is superficial branch and this is deep branch. Okay. Right. So superficial branch, it is the sensory branch, mainly sensory branch. Deep branch is a motor branch. Okay. Now all the muscles in the palm supplied by ulnar nerve only, deep branch of ulnar nerve, except lobe muscles. So deep branch, please write, it supplies all the muscles of palm except lobe muscles, lumbricals 1 and 2, opponens pollicis, abductor pollicis brevis, and flexor pollicis brevis. So except these muscles, remaining all the muscles in the palm supplied by ulnar nerve, deep branch. Now superficial branch, sensory branch. Okay, it supplies medial 1.5 digits, sensory supply. So it carries sensory supply, sensory fibers to the medial 1.5 digits in the palm. In the palmar side, lateral 3.5 digits sensory supply by median nerve. Yes, already we know this. So this is the middle side, lateral side. So lateral 3.5 digits. This area is supplied by sensory fibers carried by median nerve, and medial 1.5 digits, the sensory fibers carried by ulnar nerve. Okay. Now one important point about the superficial branch is the superficial branch give motor supply to one small muscle in the palm. That muscle is present subcutaneously. That is a subcutaneous muscle. That muscle is palmaris brevis. So palmaris brevis, it is the small subcutaneous muscle present in the palm. It is the subcutaneous muscle present in the palm. So this muscle is supplied by superficial branch of ulnar nerve, not deep branch. Okay. So palmaris brevis is supplied by superficial branch of ulnar nerve. In the exams, they will ask you directly, which are the following supplied by or not supplied by deep branch of ulnar nerve or superficial branch. The questions will be direct. Okay. The recent exams, they are asking specific questions. So please remember, the superficial branch supplies only one small subcutaneous muscle in the palm, palmaris brevis. So I told you already, superficial branch is predominantly sensory. Okay. Right. So that's all about the course and the branches of the ulnar nerve. So now see the diagram. So in the diagram, yes, we are seeing palm muscles. I told you, palm muscles, lobe muscle supplied by median nerve, remaining ulnar nerve only. So we're going to list out the muscles supplied by ulnar nerve. Again, no need to by heart this. Just remember lobe muscle, that is more than sufficient. So we're going to list out the muscles supplied by our ulnar nerve. Just read once and then forget, no problem. But don't forget lobe. So muscles supplied by ulnar nerve in the palm. So in the palm, the ulnar nerve supplies, number 1, ulnar nerve supplies the following muscles. Number 1, hypothenar eminence muscle. Hypothenar eminence muscle. Now, hypothenar eminence muscle. Thenar eminence, we have three muscle. Flexor pollicis brevis, abductor pollicis brevis, and the opponens pollicis. See the diagram? Now, this is our abductor pollicis brevis. I am writing APB. Abductor pollicis brevis. And then this one, flexor pollicis brevis. If you remove these two, now in the deep layer, we are seeing opponens pollicis. Okay, fine. Right. So, muscles in the palm supplied by ulnar nerve. So, in palm, ulnar nerve supplies the following muscles. First group, hypothenar eminence muscle. Hypothenar eminence. So, thenar eminence, the eminence over the thumb, muscle supplied by median nerve. Similarly, we have one small eminence over the little finger that is called hypothenar eminence on the medial side. Now, hypothenar eminence, we write the muscle name here, we see the muscle, the diagram later. So, hypothenar eminence, three muscles. Number one, abductor digiti minimi. Abductor digiti minimi. Flexor digiti minimi. Flexor digiti minimi. And then opponens digiti minimi. A similar muscle to thenar eminence. Thenar eminence, we have abductor pollicis brevis, flexor pollicis brevis, and the opponens pollicis. In the same way, hypothenar eminence have abductor digiti minimi, flexor digiti minimi, and the opponens digiti minimi. Okay. Then lumbricals. Lumbricals, totally we have four in number. Now, lateral two lumbricals, 1 and 2 lumbricals supplied by median nerve. So, 3 and 4th lumbricals supplied by ulnar nerve. And then palmar interosseous. All the palmar interosseous, all the dorsal interosseous, they are supplied by ulnar nerve only. So, palmar interosseous. Again, we have 4 palmar interosseous and dorsal interosseous. Dorsal interosseous. Again, 4 dorsal interosseous. So, one last muscle, adductor pollicis muscle. Adductor pollicis muscle, it is supplied by the deep branch of ulnar nerve, not median nerve. Adductor pollicis, it is not the thenar eminence muscle. Thenar eminence is formed only by 3 muscles. Okay. Now, see the diagram. Yes. In the diagram, yes, we are seeing this is the thumb, lateral side, this is little finger, medial side. So, these 3 muscles, they form thenar eminence muscle. Okay. Now, this is our abductor pollicis brevis. This is flexor pollicis brevis. And this is opponens pollicis. Our adductor pollicis is present here. That is our adductor pollicis muscle. Adductor pollicis, it is not the thenar eminence muscle. Thenar eminence here only. Now, adductor pollicis muscle present here. So, this is not giving contribution to thenar eminence. So, adductor pollicis, it is supplied by the deep branch of ulnar nerve. Recent exam, 2022 NEET exam, they gave the question. Yes, 2022 NEET exam, we got question about the nerve supply of adductor pollicis muscle. Right. Now, see the diagram. Now, we mark the hypothenar eminence muscle. So, hypothenar eminence, now the first muscle, that is our abductor digiti minimi. And then this muscle, that is flexor digiti minimi. If you remove these 2 muscles, now the deep layer, we see opponens digiti minimi. I am writing only OP. Okay. Now, lumbricals. Medial to lumbricals. This is lumbrical 1, lumbrical 2, lumbrical 3, and lumbrical 4. Lumbrical 1 and 2, median nerve. 3 and 4, ulnar nerve. And palmar interosseous, dorsal interosseous. So, these are the muscles supplied by ulnar nerve in the palm. Right. We're going to test the ulnar nerve by doing one simple test, that is a Frohman test. What is Frohman test? In the Frohman test, we are checking which muscle? Adductor pollicis muscle. Now, we are giving the card or any object between the thumb and the index finger, and we are asking the patient to hold the object. Now, in the case of normal ulnar nerve, adductor pollicis muscle will be normal, and the patient adduct the thumb and hold this object. Okay. Now, in the case of ulnar nerve injury, the patient is having ulnar nerve damage, ulnar nerve injury. Now, initially, the patient have some difficulty to hold the object between the thumb and index finger because adductor pollicis muscle is not working. That muscle paralyzed. So, initially, patient having some difficulty, but later, see the diagram? Patient now using which muscle? Patient is flexing the thumb and then holding the object. So, it is compensatory flexion. So, patient is having compensatory flexion at the interphalangeal joint of the thumb and then the patient hold the object. Now, this sign is called Frohman sign. So, Frohman sign, in the ulnar nerve injury, you see Frohman sign. What is Frohman sign? Compensatory flexion of the interphalangeal joint of the thumb. So, flexion of thumb is by flexor pollicis longus and flexor pollicis brevis. Flexor pollicis brevis, median nerve. Flexor pollicis longus, anti-interosseous nerve. So, median nerve, anti-interosseous nerve normal. So, patient is flexing the thumb and then holding the card. So, the point is, even in the ulnar nerve injury, the patient hold the object. The patient hold the paper. The point is how he is holding. In the ulnar nerve injury, you see the compensatory flexion of the thumb and then he hold. That sign is called Frohman sign. Okay, so Frohman sign, Frohman test, ulnar nerve. Which muscle? Adductor pollicis muscle. Please don't forget. Now, we're going to discuss about the small muscles in the palm. We're going to discuss about lumbricals, palmar interosseous and dorsal interosseous. See, from 2018, I'm saying we are getting one question from the lumbricals on the palmar interosseous and the dorsal interosseous. Right. Now, lumbricals. How many lumbricals we have? We have 4 lumbricals. Now, lumbricals are named from lateral to medial. So, first lumbrical is lateral and the 4th lumbrical is medial. Okay. So, see the 1 and 2 lumbricals. The 1 and 2 lumbricals, it is having only one slip of origin. And origin, they take origin not from the bone. Lumbricals, they take origin from tendon. What tendon? This white structure, no? That is our FDP tendon. So, okay. So, origin, we write. So, origin of lumbricals from FDP tendon. Origin, FDP tendon. Now, see the lumbricals 1 and 2. So, lumbricals 1 and 2, they have only one slip of origin. They arise from only one side. So, lumbricals 1 and 2. 1 and 2 lumbricals, they are unipinnate, having only one slip. Now, 3 and 4 lumbricals, see here, the 3rd and 4th lumbricals, they having 2 slip of origin on either side. So, 3rd and 4th lumbricals, 3 and 4 lumbricals, they are bipinnate. Right. Now, we know the nerve supply. Lumbricals 1 and 2 supplied by median nerve. Lumbricals 3 and 4 supplied by deep branch of ulnar nerve. Okay. Now, what about the insertion? After taking origin, the muscle fibers go behind and inserted to dorsal digital expansion. I told you in the DDE topic itself. To DDE, our lumbricals and interosseous inserted. So, insertion to dorsal digital expansion. Dorsal digital expansion receives lumbricals and interosseous. That is why we are calling lumbricals and interosseous as winged tendons. Very good. So, origin from FDP tendon, insertion to dorsal digital expansion. Origin from the flexor compartment, insertion to extensor compartment. So, it is linking the flexor group to the extensor group. That is why we call the lumbricals as the link muscle. So, lumbricals are called as link muscle. It is linking, it is connecting the flexor group to the extensor group. Okay. So, next, what is the action of the lumbricals? Now, see the diagram. Now, the diagram, yes. Now, lumbricals, after taking origin from the FDP tendon, it is crossing this joint. That is our metacarpophalangeal joint. So, origin from the flexor compartment, and crossing the metacarpophalangeal joint in the front side, and it is going behind to DDE. Okay, so it is crossing the metacarpophalangeal joint in the front side. So what is action? Flexion of metacarpophalangeal joint. So action of lumbricals, please write. Action of lumbricals, flex the metacarpophalangeal joint and inserting to DDE, dorsal digital expansion. I told you, dorsal digital expansion extend the interphalangeal joint. So any structure attaching to DDE, what they do? They also extend the interphalangeal joint. So what is the action of lumbricals? Not only lumbricals, even interosseous will do the same movement. So flexion of metacarpophalangeal joint flexed and the interphalangeal joint extended. Okay, so this is the action of lumbricals. This is a common action for lumbricals, palmar interosseous, dorsal interosseous. So all these three muscles, they do flexion of metacarpophalangeal joint and the extension of interphalangeal joint. Clear? Right. So that's all about our lumbricals. Next, palmar interosseous. So palmar interosseous, yes, we have 4 palmar interosseous. Again, they are named from the lateral to medial side. Okay, now see the diagram. Palmar interosseous origin from metacarpal bone. This is a carpal bone. That is carpal bone. This is metacarpal bone. Okay, so palmar interosseous, they take origin from only one side of the metacarpal bone. So it is having only one slip of fibers. That means palmar interosseous unipinnate muscle, only one slip of fiber. Okay, right. Insertion, we know. Insertion to dorsal digital expansion. Okay. Next, what is the nerve supply? Nerve supply, we know all the muscles in the palm supplied by our deep branch of ulnar nerve, except loaf muscle. So nerve supply also over. Now what is action? Action, just now I told you, along with the lumbricals, flex the metacarpophalangeal joint and extend the interphalangeal joint. Okay, right. Now one more action is there. Palmar interosseous adduct the fingers, adduction of the digits. Again, we have old mnemonic, pad dab. Yes, so palmar interosseous do adduction of fingers, dorsal interosseous abduction of the fingers. Very important. So we have 3 actions for our palmar interosseous: flexion of metacarpophalangeal joint, extension of interphalangeal joint, and the adduction of the digits, adduction of the fingers. That means the finger move towards the midline. So the midline we have middle finger. So the other fingers, they move towards middle finger. Now in 2019 AIMS exam, we got the question, which finger is not having the attachment of palmar interosseous? Middle finger, it is not having the attachment of palmar interosseous. Why? Because middle finger already in midline only. We don't need any other muscle to move the middle finger to midline, no? So middle finger, it is not having the attachment of palmar interosseous. This is very important. 2019 November AIMS exam, we got this question. Okay, right. So the diagram. Yes, palmar interosseous, origin from metacarpal bone, only one side, and going to DDE. Next, dorsal interosseous. Okay, so again dorsal interosseous, 4 in number. They are named from lateral to medial. All the dorsal interosseous, they are supplied by the deep branch of ulnar nerve. Now see the origin. Now origin from the metacarpal bone only, but muscle fibers that take origin from the 2 adjacent metacarpal bones having 2 slip of origin. So dorsal interosseous bipinnate muscle, okay, having 2 slips of origin. Right. Now what about insertion? Insertion, we know palmar interosseous, dorsal interosseous, lumbricals, they are inserted to DDE. Okay. Now what is action? Now supply we completed. Action, the common action, flexion of metacarpophalangeal joint and extension of interphalangeal joint. Along with that, I told you pad dab. So dorsal interosseous, they do abduction of the fingers. Okay, so abduction done by dorsal interosseous muscle. They move away from the midline. So now again, your little finger and the thumb, they are not having the attachment of dorsal interosseous. Why? Because little finger and thumb, they have a separate muscle for abduction. The middle three fingers only, they are having the attachment of dorsal interosseous. Okay, so little finger, this is little finger and this is thumb. They have a separate muscle for abduction, abductor digiti minimi. Thumb, we have two muscles, abductor pollicis longus, abductor pollicis brevis. So these two muscles, yes, they do abduction of thumb. So please write the thumb and the little finger, they are not having attachment of, dorsal interosseous. Why? They have a separate muscle. They have a separate muscle for this movement, for abduction. What are those? For thumb, abductor pollicis brevis, abductor pollicis longus. Two muscles will do that. And for little finger, abductor digiti minimi. So little finger and thumb, they are not having attachment of dorsal interosseous. So only three fingers receiving four dorsal interosseous. Okay, see the diagram. So in the diagram, this is our first dorsal interosseous. This is second, this is third, and this is fourth. This is your index finger, this is middle finger, and this is our ring finger. Okay, right. So now first dorsal interosseous attaching to index finger. I write one here. Now second dorsal interosseous attaching to second fibrous tendon is coming here and attached to middle finger. Okay. Now third one, see here, again these fibers are coming and they are going to middle finger only. And fourth one attaching to ring finger. Clear? So we have four muscle attaching to three fingers. So please write the first dorsal interosseous attached to index finger. Now second and third attached to middle finger. Fourth one attached to ring finger. Again, in the exam 2019 May AIMS exam, we got the question. The question is the second dorsal interosseous attaching to which finger? Answer middle finger. Okay, right. Now we're going to see the animations for the ulnar nerve. Now ulnar nerve, yes, does not give any branch in the arm. The ulnar nerve, yes, will be passing behind the medial epicondyle. And see here, we removed some muscles in the flexor compartment of forearm. So now, so that we are seeing this muscle, that is our flexor carpi ulnaris muscle, and this is the FDP muscle. Now see the ulnar nerve there. Now ulnar nerve is passing behind this bony point. That is our medial epicondyle. Very good. Now ulnar nerve is passing behind and then enters the forearm. It supplies two muscles. This muscle is our flexor carpi ulnaris muscle and this muscle is our flexor digitorum profundus muscle, medial half of FDP. That means tendon to the little finger and the ring finger. So these two muscles in the forearm, it is supplied by our ulnar nerve. So ulnar nerve in the forearm supplies only 1.5 muscle, flexor carpi ulnaris and FDP muscle, tendon to little finger and the ring finger. Clear? Right. Now after supplying these 1.5 muscles, the ulnar nerve enters the forearm. Now in the forearm, very important, median nerve is passing below the tunnel, whereas ulnar nerve, see the ulnar nerve, it is passing above the tunnel, above the flexor retinaculum. See the ulnar nerve is passing above the retinaculum band and then enters the palm. And in the palm, which is divided into superficial branch and deep branch. Superficial branch, sensory branch, deep branch, motor branch. Motor branch supplies all the muscles of palm except the loaf muscles. Okay, so lumbricals, palmar interosseous, dorsal interosseous, yes, very important. They are the high yield topics. In the recent exams, we are getting questions from these three muscles only.